Clear guidance on masks is one thing, but some childcare providers say Maine needs to change up COVID protocols in other ways. And it's especially important because there's no vaccine approved yet for kids under the age of 5.
Now, when Pfizer and the FDA announced a vaccine delay for that age group, childcare workers in our state started asking public health leaders for help. I spoke to some workers at the Bath Area Family YMCA about the challenges the current guidelines create. Classrooms are looking slightly more normal.
Building this SpongeBob.
How high can you go?
At the Bath Area Family YMCA, having all these kids here is a sight for sore eyes.
It was inevitable that COVID was going to continue to impact us. What do you need?
A Band-Aid?
They avoided any COVID-related shutdowns until their first one in November. Since then, they've had kids stuck in serial quarantine. Out for 10 days, back for 1, exposed again, then back out for another 10 days.
It's the hardest day to have to call families and tell them that their child has been exposed, maybe again, and that they have to come pick their kid up. I'm sorry, I didn't think I'd get emotional because it feels like we disappoint them.
The families? The kids?
All of them.
Those phone calls have a domino effect. Kids out of school means parents out of work.
Parents were very frustrated and angry with us at times because our guidance did not align with what the schools had decided.
Parents are constantly bracing, so when they're picking their kid up at the end of the day, any COVID cases today, where are we at with COVID? Childcare providers are stressed, but it's really because the families we serve are under incredible amounts of stress and disruption in their lives.
So they joined childcares around the state and wrote a letter to the Maine CDC 2 weeks ago. They want shorter quarantine times, plus allowing kids to return to school as long as they test negative, and letting asymptomatic kids stay in class. They say this is more efficient than pooled testing, but still safe, especially as those who can get the vaccine start to see loosening restrictions.
Right, the rules change when you become vaccinated. We're not there in childcare. We don't get that luxury to move forward because we work with the youngest children who are still most vulnerable, who do not have access to vaccines yet. Our job is to keep the children safe and healthy and to protect our programs and to remain open as much as possible for families.
That was the one that really struck me, that they're not there yet. So the director of advocacy tells me she and others met with Maine CDC Director Dr. Nirav Shah and the Director of Child and Family Services yesterday about the guidance they'd like to see change. She told me it was a positive discussion. Now, today's update from the state about masking also notes updates to isolation and quarantine guidance that will come from the state in the near future.